Good morning, welcome to Sports Radio 1310, The Ticket. George D. John, Train Station Fitness Show. My very good friend, Dr. Kevin Light, is in the studio. Good morning, my friend.
Good morning, George.
This is a show that I kind of touched on before, some by myself, some with Dr. Webster, but never from this angle because you are a doctor who does integrative medicine. You're a board-certified general surgeon. You're known as the boob and butt guy. You give girls the butt implants for a Brazilian butt. You give them the boobs. All those good things. And we're also talking about how you have now taken on an additional specialty of hormone replacement therapy. There's some scary things today about doctors who all of a sudden go back to school and learn hormone replacement therapy and think that they know all. And we'll discuss that later on. I don't want to discuss that now because the show's topic today is literally just about testosterone replacement. Why do people need testosterone? How are you voluntarily contributing to lowering your testosterone, which creates an imbalance in other hormones? Females, this show is for you also because you do produce testosterone, although it's, 10 times less than a male?
10 to 20 times.
Less than a male?
Correct.
You need testosterone. So no one is exempt from listening to this show at any age, because Dr. Light and I will talk about what age you can begin to experience low testosterone levels. We'll discuss the ramifications of eating a certain way that affect your testosterone and lack of exercise. We'll discuss how to increase it naturally and what you can do from a bioidentical standpoint of replacing testosterone. What does bioidentical mean, and why do you need a certain type of administration, if you will, of testosterone versus another? How some can be dangerous. This is a real big show today. I don't know if we'll have time for calls. Most of the time we do not. But I think we'll take some calls today, so you might want to stay tuned. Dr. Light, some symptoms of people who experience low testosterone, and regardless of the age, what are some of the symptoms?
Well, the most common that you see both with men and women, you'll see loss of libido. They just get sort of apathetic about life. You have problems with the way you think. You're really not that clear.
People will say, hold on, Dr. Light. I'll blame that on my age. I'm 40, I'm 50, I'm starting to forget where my keys are. That's just part of age. Well, also part of age is?
Well, it's part of age, but there's a reason it's a part of your age. What happens when you age? Well, when you age, you get low testosterone.
Right. So, weight gain, fat gain, hair loss, breast enlargement in men. Yes, this is true.
It's a biggie.
Depression, fatigue, irritability, and mood swings, hot flashes and night sweats, all that good stuff, are all symptoms of low testosterone. Does that mean you don't have another condition? Not necessarily, but today's show, low testosterone, how to fix it. Can it be fixed? 704 Sports Radio 1310, The Ticket. 712 Sports Radio 1310, The Ticket. George D. John, Train Station Fitness Show. My good friend Dr. Kevin Light is on the show. Does integrative medicine, board certified and general surgeon, and known as the boob and butt guy because he does some good plastic surgery. We're talking about testosterone replacement therapy today and the importance of that in your system regardless of your gender. First, Dr. Light, talk about testosterone and why we all need testosterone regardless of your age.
Well, testosterone receptors are everywhere in your body, literally everywhere in your body. You have them in your brain, you have them in your heart. Obviously, you have them in your muscles and your skin, and not just your genitalia. So it's...
Hold on, you said obviously you have them in your muscles and your skin. That's not obvious to the majority of the people listening. What do you mean by your skin?
For men, testosterone and its byproducts are responsible for what are called your secondary sexual characteristics, the hair patterns, your musculature, and everybody, I would assume, knows that when you enhance your testosterone through supplements or artificially, then your muscle mass gets larger. People with high testosterone levels tend to be more muscular and better developed.
How's it affecting their skin, though?
Well, in terms of their skin, the testosterone makes your skin healthier. It has a better blood supply. The skin is thicker. People with low testosterone tend to be a bit sallow, and they have thin skin. It's very dry.
So do you know who you're attracting right now when you're saying that? You're perking they're piquing the interest of more of the females. Whenever you talk about skin and the benefits.
It's a big deal with girls. Testosterone in females testosterone is a critical drug for all women. Any woman over 40 has a testosterone problem.
has a testosterone problem. So what are let's go through some of that again. Specifically for women, what are some of the symptoms that a woman might feel if she has low testosterone?
I see women like this all the time. You know, it's important to realize that the levels of testosterone in a woman at age 20 is twice as much as the levels of testosterone in their blood at age 50. And basically, most women around 40-ish, maybe 35, 40-ish, will start to see symptoms of testosterone deficiency. And typically that presents as loss of libido. I have these 40-year-old ladies who come in, they've got their 2.3 kids, they're working, they've got the stresses of life, and they have no libido, and they think, well, it's just because I'm busy, it's just because this, that, and I have kids, and it's almost expected that a woman in her early to mid-40s is going to have no sex drive. Well, that's preposterous.
How many times have we heard about women as they get older, they get more excited where the man is getting less excited? It's kind of this miss, if you will.
Well,
that's the way it's supposed to be.
You see that a lot too, but I see, you of course, you hear about women who peak out at 40, and that's the kind of woman all of us guys sometimes want to hook up with, right, if we're single. But the thing of it is that a whole bunch of ladies, and I see them all the time, 40, 45 years old, 50 years old, and they have little to no sex drive. And for many ladies, it's fine because their husband doesn't have it either. We say, you want us to fix it for you? They go, well, that'll create a problem because hubby doesn't have it either. I said, well, get both of you in my clinic and we'll fix it.
Talk about, and this is really, really important for people to understand. I don't want to go really long on this, so give us kind of a synopsis, if you will, of this. Cholesterol, the importance of cholesterol and how it affects testosterone.
Well, all of your hormones are made from cholesterol. People don't realize that. That's why cholesterol is critical. And there's been a lot of disinformation in the medical community and the public that high cholesterol is bad. Well, that's not true at all. And if you lower your cholesterol to these levels of 120, 110, 130, then you're not going to have the building blocks that you need to make testosterone, estrogen, all the other critical hormones in your body. Cholesterol are the building blocks of a lot of good things, and that's why it's there. The fact that it's elevated in some people basically is because your body is trying to mount a response to whatever is wrong with you, but it's not the cholesterol causing the problem.
Right. Talk about we discussed what the involuntary contributors are, age.
Mm-hmm.
The voluntary contributors to lowering your own testosterone and creating hormone imbalance. You mentioned some earlier. You've got, several kids, so you're always busy and running around with that mentally. Becomes stressed, adrenal fatigue, fast food, sugars, all of that. What are some of the other voluntary contributors that people may not realize that they're volunteering? They're signing up to say, hey, please lower my testosterone so I can be depressed, moody, and not have a sex drive. And attract disease, by the way, which we can get into in a little while.
Well, let me sort of lay the groundwork for this. If, say, you're building 4 houses and they all are made of brick, and we're going to have the estrogen house and the testosterone house and the cortisol house, and all these houses go to the same brick supply. Well, if you're burning a lot of any of the other hormones, then there's no more bricks for the other things. So where am I going with this? Well, if you eat a lot of starches and simple sugars and a lot of sweets, you're going to increase your insulin and you're going to increase the stress in your body, so that gobbles up all the good stuff, and so your testosterone goes down. If you are overweight and obese, you have a lot of the enzyme called aromatase, and aromatase is a biggie that takes testosterone and turns it into estrogen. That's why guys, when they have low testosterone, which is pretty much most males over the age of 45, they get that little paunch, they get the boobs, and they have all these problems because they have all this estrogen floating around. Stress will eat testosterone like nothing else. And when you have a high-stress life, pretty much every guy who's one of these movers and shakers and going 24/7 have low testosterone. So diet, lifestyle, lack of exercise, obesity, what you eat. Again, if you want to have a good high testosterone levels, you're going to be eating protein. You're going to be eating fruits and vegetables. You're going to be eating the good stuff.
And exercising. So we'll discuss some of the things you can do later to increase your testosterone. But I want to let everyone know that we're going to take calls here coming up on the second half of the show. So if you have an idea of what you want to ask Dr. Light about replacing your testosterone, make sure you give us a call here. We'll do that here the second part of the show. I'll give you the number now, 888-787-1310. What's considered a healthy testosterone in a man 30 years old, and what's considered a healthy testosterone in a man 50 years old? We'll do the same for a woman.
It depends. The number is less critical than the symptoms. Now, it's just sort of a vague or place to start. For a guy who's 30 years old, you'd like to see a testosterone near 1,000. Okay, what was the second part of your question?
For a 50-year-old man.
For a 50-year-old man, again, 800 to 1,000.
But the guidelines, hold on, Dr. Light, the guidelines say more like, what, 500 or 600?
Well, the guidelines say anything under over 300 is normal, okay? So what is normal? Well, they take 10,000 people from the ages of 15 to 80, and you can be fat, skinny, black, white, old, young, diseased, or healthy, and they take all those numbers and they go, okay, here's normal. So anything under 300 is abnormal. Well, anything under 300 is disease. What's optimum? And that's the question. Optimum is what you were when you were 28 or 30, and that's around 1,000. Whether you're, because you're the same size, so whether you're 20 or 70, you need a testosterone of about 1,000 or 800.
So, but what about those who say, hold on, if you're doing that at an older age, because I guess this question isn't really that valid anymore, but for some people they may have this in their mind. And what I'm getting at is, years ago, not too long ago, there were two sides of the fence with testosterone, like there are with growth hormone. One side says it's healthy to replace it, another one says it's not. Well, growth hormone, the jury's still out on some of that, okay? Some yes, some no. The consensus now is that everyone's on board who's studied replacing your testosterone, that it is healthy for you regardless of your age. It has to do with symptoms and your numbers. So what about someone who says, okay, if I'm 50 or 60 years old and you're giving me a testosterone of 1,000, isn't that dangerous at my age? I know the answer, but I venture to guess there's others that are thinking, well, do I really need to be that high?
The answer is almost never, and there's clear studies. Now we have hard science. Hard science shows that far less incidence of heart disease, less Alzheimer's, less diabetes, less prostate cancer. Did you hear that? Less prostate cancer with a normal testosterone.
And that's important. I want to get that. I know my parents are always listening to the show, and others who are in their 60s and older, that we know for a fact, studies have showed, hard evidence has shown, that a man, Dr. Light, get me on the number if I'm incorrect on this, who is 80 or 81 years old or older will have a level of prostate cancer when they're dead. If they live to 80 or older, it just depends. Go ahead.
I don't know about the age of 80, but
that's what there were studies showing.
Studies show that if you live long enough,
as a male,
you biopsy these prostates, you'll find cancer in just about every case. But the significance of that has changed over time, and a number of experts will say that you will die of something else decades before that prostate cancer will ever affect you.
So testosterone can really help you regardless of your age. We have to look at the levels and look at your symptoms.
That's true, and the important thing is to know is that testosterone does not cause prostate cancer. It does not.
Does not, exactly. Again, we used to have two sides of the fence. We don't anymore for the educated person. Women. Let's talk about women and when they begin to lose their testosterone and how that affects them. You talked about some of the effects earlier, but let's hone in on women. We've got a couple of minutes.
Osteoporosis is a big problem with low testosterone. Another thing is cloudy thinking, apathy, fatigue. A lot of women, they get to be their mid-40s and they just blame a lot of their fatigue and unclear thinking on just lifestyle, but it's a big deal. Heart health is women are affected by cardiac disease just like men are, and testosterone is a big player.
What about having testosterone for a long period of time and it affecting cholesterol in a negative way? I know the answer. Like I said, we've done the research, but someone mentioned that to me not too long ago, and I was thinking, but either you have unhealthy levels of testosterone that you're going higher than you need to, because the consensus is really you need levels of 700 to 1,000, not 1,000. But you're saying 1,000, so that's your research. I've just happened to see anywhere between 700.
Well, 800 is the number that's in the literature the most.
In literature, that's right, 800. That's true. So you take the mean. But people who say if you have testosterone, you're on it for too long, regardless of whether it's bioidentical or not, that it'll affect your testosterone in a negative, cholesterol in a negative way.
Well, testosterone will lower your cholesterol in pretty much all cases.
So it's even long term, it's not going to affect it in a negative way, right?
Well, if you keep it physiologic, it's not going to affect it in a negative way.
And let's actually do that right now. Talk about different types of testosterone replacement before you get to a bioidentical? Oral, injectable, gel, cream. What are the benefits and the disadvantages and advantages of each?
Creams are the most commonly used, and it's liked by most people that do what I do. Creams are convenient, they're quick, and they give very good levels. You can have, you never want to take oral testosterone, although a lot of people still prescribe it. I think that's a travesty. Oral testosterone, you don't have the availability, the liver tears it down, it causes a lot of liver problems potentially. That's not good. You can get testosterone injected as pellets underneath your skin. The problem is, if you misjudge the dose, then you really can't adjust it if you have those pellets. And it's a surgical procedure every 4 to 6 months, and who wants to do that?
Right.
So pellets are really a good way to do it. Those are the big ones that we have.
Coming up next, I want you to share what bioidentical hormones are, and why, if you're going to use any hormone replacement therapy, bioidentical is the way to go. Otherwise, you're doing yourself a serious disservice. So Dr. Kevin Light, coming up next, we're talking about replacing your testosterone, the benefits of it, and whether you're a man or a woman, it doesn't matter. And bioidentical hormones, what they are, coming up next. Also, if you want to call with any questions or comments on this topic, call us coming up next part of the show, 888-787-1310, 725 Sports Radio 1310 The Ticket.
Hello.
All right, 735 Sports Radio 1310 The Ticket, George D. John Train Station Fitness Show. My friend Dr. Kevin Light is in the studio. We're talking about replacing your testosterone and how it will benefit you if you're experiencing symptoms of low testosterone at any age. There's something we've got to get to before we talk about bioidentical hormones, and I threw this out to people because I normally don't take calls, but I'll let you call in right now if you'd like. The number is 888-787-1310. Anything about testosterone, but let's do this first, Doc. The questions you ask someone who you're thinking about having testosterone replacement therapy through. What are the tests that have to be performed in detail, if you can do that, and what are the questions you have to ask?
Okay, well, a lot of people are getting into this business, and the important thing to realize is that testosterone therapy is pretty complex. And when your testosterone is out of kilter, it affects everything else. So you have to look at the whole picture. And why is that important? When you come into my office, we don't just check your testosterone. We check all of your hormones, because one affects the other. You have to have everything balanced so that everything works well. You need to check you need to check thyroid. You need to check estrogen. You need to check the dihydrotestosterone, which is called bad testosterone. You have to check
otherwise known as DHT.
DHT. You have to check your PSA levels. Okay. You have to check your prostate health. There's a number of things that we have to check and monitor as we treat you. You don't want to just go into somebody, have them slap you on a little testosterone and say, have a nice life. That's can be very, very dangerous and cause a lot of problems.
But you see, check testosterone, but what about free testosterone?
Well, the important, that you bring up a good point. Free testosterone is really the only testosterone that's working at the cellular level. So your total testosterone levels, they are a good indication of where you need to be, but it's the free testosterone that actually is the most important. And well, why do you need to check that? Because you can have lots of testosterone floating around your blood, but if it's not free, it's not working. And there's things that prevent your testosterone from getting into your cells. One of them is called a sex hormone binding globulin, which is the truck that trucks testosterone around, but sometimes it won't let testosterone out of the bus.
Well, that's good to know. Anywhere. Give me 3 top questions if someone's they're thinking about doing testosterone replacement therapy, what they've got to ask their doctor or look for with their potential doctor. Because if the doctor answers them different than what you're about to mention, you might want to look for another doctor. You and I discussed this off the air because it's something that bothered me several years ago.
Well, the big thing is what test are you going to run? If they're just monitoring testosterone, they're not checking free testosterone, they're not checking estrogens, and they're not checking your DHT, then you know they're really not quite sure what they're doing. That's probably the biggest. The other thing is they have to check into your diet. If they're not asking other questions that bring your testosterone down, what is your diet like?
And do they have a nutrition background where they went to school for this?
Exactly. What's your life like? What's your stress? What are the other things that are causing this testosterone to come down that you can do to improve the situation other than just putting some cream on you?
Okay, if you have any questions about testosterone replacement therapy, you're just thinking about whether you want to do it or not, give us a call, 888-787-1310. Let's go to Rob in Denton. Rob, you're on the ticket.
Good morning.
Good morning.
I'm going to be 50 in June. My wife is 44, and we've both been diagnosed with low testosterone. She just started the Sotopelli about 3 weeks ago, and she's really improving on it. We both burst train. Our diet is excellent. We both take proper supplements. My testosterone is about 290, but for me, it was going to be like $1,500 a year. I wasn't so sold on having something inserted. But I guess the positive part of Sotopelli is it's a constant. It's the way it's developed, or it's more.
Well, what's your question for you, Rob?
Well, my problem is I'm wondering what is the best method, because there are shots under the bioidentical. There are shots. There's Sotopelli. There are creams. The Wiley protocol.
Okay, well then we're about to discuss that right now. We'll share that with you. There's two things that you can do. There's three things you can do. Why don't we do some of the remedies? We have some calls coming in. If you have any questions about testosterone, you want to know if it'll benefit you or not, call us 888-787-1310. Bioidentical hormones, real fast.
Okay, the problem with the pellets is you can't adjust the dose. And so if you have not enough, put in more pellets. If you have too much, what are you going to do? Take the pellets out? We don't like to use that. Shots are okay, but shots, you basically give the shots once a week, but the shots, you go up and you go down, so it's not a constant steady state. We like creams. Creams keep everything nice and humming along at a very stable level, and that's what we use.
Can you use, or are there shots that are a bioidentical hormone too?
Well, yeah.
I didn't know if they had the shots that were.
Well, the shots are not quite bioidentical. It's testosterone cyprinate, but the creams are. They're all plant-based.
Rob, what Dr. Light was saying when he said it goes up, it goes down, is there's a half-life to testosterone when you do an injection, and especially when you do it once a week. And you'll get a spike, a surge, if you will, in the way you feel in your testosterone and symptoms. And then all of a sudden it starts to come down after about 3 or 4 days, and then you have to wait that full week before you have another shot. If you use a cream, I know about the gels, by the way. The gels actually raise DHT.
Well, they both can. Creams and gels can raise DHT if you have that little machine in your body that makes that happen.
Oh, okay.
Okay.
Well, what I researched is that a bioidentical cream is the safest way to go.
Well, gels are bioidentical as well.
Right, but I mean the cream versus the gel. I thought there was a difference. There's no difference?
There's very little difference. The creams sometimes cause skin irritation, so that's why some guys, the gels sometimes cause skin irritation, so that's why some guys use creams. There's also testosterone patches, again, cause irritation, but it's all bioidentical.
Davey, let's take one more call. Who is that? Well, put him on. You're on the ticket.
Hey, guys. Good morning.
Who's this?
Jonathan.
Hey, Jonathan. Go ahead.
Hey, man. Yeah, I had a question. I'm looking into this stuff. I've actually just started it. And everybody that I've talked to seems to think that I'm 27 and my levels are pretty low. So that's why I've started it. But they say that if you have no children, that you need to start with the HCG as well. I mean, is that true? Is it going to affect your ability to have children later on?
Well, you're partially right. When you're young and your testosterone is low, that's probably because your pituitary isn't telling your testicles to say, hey, dude, put out some of that testosterone. So your testicles aren't getting the message. So in that case, you want to use, a lot of doctors will use HCG to sort of rattle your testicles to produce more testosterone. You don't want to use that exclusively, though. You want to add a little testosterone as well. Because there's a whole lot of reasons we won't get into right now, but you never want to use HCG therapy alone. It's always in conjunction with testosterone in the younger patient. In the older patients, the problem is not the pituitary, it's our testicles just quit working because they're getting old. And those are the people who really need just the testosterone.
Jonathan, have you used anything for replacing testosterone, like bodybuilder supplements and stuff like that in the past?
Yeah, I've used some stuff that, you can buy on the internet or, GNC, just from doing the research on my own. And the only thing that I've noticed that any of those help is I just sleep a little better at night. My levels haven't gone up any.
Let me just share this with you from personal experience. Anybody who uses any supplement over-the-counter retail for raising your testosterone, it is not bioidentical. The body doesn't recognize it, therefore it'll turn off your natural testosterone and can wreak havoc on your body. What happened to me is I was using that stuff for about 12 or 15 years. The stuff over the counter that said, in these smoothie places that said, and I've talked about this story many times on the radio, I'll just share it with you in case you haven't heard it, that says 4 times stronger than testosterone. So I took it because I would pride myself on not taking steroids. And I was massive. I'm 5'10", I was 208 pounds, squatted 675 10 times. I mean, I was very, very strong. Why am I saying this? Not to brag, because when I would get off of it, I would lose massive amounts of strength. I would lose about 7 or 8 pounds, and I would feel depressed. I would tear up in commercials that were sad commercials, like these dog commercials that are in pounds and sick and abused, and it was horrible. My own testosterone was down to 211, which is where you attract disease, heart disease, other diseases. That's very, very dangerous. So for people who are thinking, George, you're just doing another show to help us understand, testosterone is important, but how important is it really? If your testosterone is too low, you're in a danger zone. This is when you actually need it. This is not anything new and radical. This is something that we absolutely need to help us preserve our health. So coming up next, what Dr. Light and I are going to do, so with that said, I've been on bioidentical hormones now for 7 years. And about 3 weeks or 4 weeks after I started them, I was as happy as I could possibly be. Everything was normalized, and I'm not even big anymore. People think when you're on testosterone, which is what we consider steroids, that you're going to be big. I've lost 30 pounds. Over the past 3 years, I've lost 30, or 2.5 years, I've lost 30 pounds because I didn't want to be big anymore. So by having testosterone, it doesn't mean you have to be big. It doesn't have to work that way.
Right, you have to disassociate the word testosterone with steroids.
Yeah, I know, but people don't. They're not going to do it for a long time.
There's that buzz that goes
right.
with it.
Coming up next, we're going to talk about ways you can increase your testosterone or your overall hormone imbalance or balance naturally. And then we'll also talk about how to get in touch with Dr. Light to do testosterone bioidentical creams for you. It's 7:46, Sports Radio 1310 The Ticket. 7:55, Sports Radio 1310 The Ticket. George D. John Train Station Fitness Show. We've been discussing testosterone replacement therapy, the importance of testosterone for both men and women. And like the guy, I think his name was Rob, who called, his wife is on it, and she's seen improvements in 3 weeks. And we discussed some of the benefits of that, from preventing osteoporosis, so you gain bone mass, muscle mass. It doesn't mean you get big females. It doesn't work that way.
You just stay healthy.
Stay healthy. You feel better. Your mood improves. You've got more sustained energy throughout the day. All of the benefits of when you felt invincible when you were in 20s, or most of them, can come back. And it's a short period of time if you have the right level. First, let's discuss how people can raise their testosterone naturally. You go through a few, and I'll go through a few.
Okay, well, one of the things you can do is exercise. Exercise has been shown to improve and increase your own testosterone production. Excuse me. Another thing is to eat right. Diet's critically important. You don't want to eat a bunch of sweets, pastas, breads. Those all drive your testosterone down. Anything that raises your insulin will lower your testosterone. That's just a fact. So you want to eat a lot of meat and vegetables and good proteins. And another thing you can do is manage your stress. Stress will just destroy testosterone. And so find ways to deal with stress, and don't get fat. People with high fat contents all have low testosterone, and it's a real problem.
Now, let's also just say, Dr. Light said people who have high fat content have low testosterone. That doesn't mean you have to be big to be fat. We're talking about a muscle to fat ratio here is
percent body fat.
Percent body fat, so you could be skinny fat. So let me give you some more specifics. Deadlifts, if you're conditioned to do them, squats, if you're conditioned to do them, and burst training like sprints, hitting a heavy bag, working out with weights in a specific fashion, in a burst training fashion, will all help to release growth hormone, which is responsible for strengthening your immune system and lowering body fat, and it'll also to raise your testosterone. Studies have proven this for many years, 15, 20 years, that heavy squats, heavy deadlifts will release higher amounts of testosterone and growth hormone. If you can't do them, don't want to do them, you don't have to. These are just options for you. There's a supplement you can use also. I don't really recommend going this route, but if you need to go the cheap route, you can do it. However, you may get some ill effects from it because your body doesn't really recognize it, and it'll turn off your natural testosterone. It's called Tribulus terrestris. It's been around ever since I was a kid and I was into the muscle head ways of exercise. And the best one on the market, I understand, comes from Standard Process. I don't know how to get in touch with them. Don't email me on it. Look up Standard Process and try to find Tribulus terrestris. It can raise your testosterone about 150 basis points. But keep this in mind. How does that affect other hormones in your body if you're just attacking testosterone? Hence the reason I had to go through hormone replacement therapy, because I screwed myself up by using over-the-counter products for my testosterone. So keep that in mind. I would love for you to call Dr. Light. His website is TIFM.com, Texas Institute of Functional Medicine. So TIF as in Frank, M as in Mary.com, 972-661-8436. Thank you for coming on the air. Great job today.
Thank you, George.
T-Box is in the studio. Haven't seen you in a while.
Why not?
I don't know.
We were off last week.
Oh, yeah.
Way off.
Yeah. Off the grid.
Come on. You're very green today.
Green.
He's got a shirt on. Well, a little hat. It's kind of coordinated.
Looks good.
That's my other son's new alma mater. Jacksonville University. The Dolphins.
The Green Lantern.
Green Lantern.
How you doing with your fat loss?
Very good. 20 pounds.
Yeah, he looks good.
20 pounds?
I'm at my 2006 weight right now.
Yeah.
I'm going by years now.
Yeah.
So I want to get to my 1995 weight.
All right.
And that's how I'm marking it.
Good.
So, yeah.
Has exercise changed at all, or has it been 100% diet?
It's 100% diet. As a matter of fact, I've been working out less. You had somebody on a couple weeks ago. You said there's times you just need a break.
Yeah.
I was at a workout break, and it's been hard to, I've been dieting perfect, and at our age, that's a lot of it's just all diet, right?
I don't know if it's at our age, but that can have something more to do with it. When you're for the purposes of this show, when your testosterone goes lower and hormones are out of balance, it's easier to gain fat. So just from an age standpoint,
right?
Yeah.
So
you'd be surprised though, Craig. I'm gonna make a little promise to you that when you come back on crazy exercise again,
yeah.
How long was your break?
It's been 5 weeks. I'm gonna April 1.
No exercise?
It's not. I mean, I was 5 days a week hard.
How many now on the break?
I'm playing basketball twice a week, so I'm doing my cardio still twice a week, and I'm probably lifting maybe once.
Okay, so
I've
make a little
really moved it down.
promise to you. When you get back into the strength training again, that you will, after a short period of time, be stronger. Because when the body gets the break and it gets to regenerate again, you come back again, you'll get a couple of things out of it. You'll gain motivation.
I have that.
Okay, you've gained motivation, or you've not lost it.
I'm like looking forward to April 1st. That's when I'm starting back.
You'll gain motivation, and you may even gain a little bit of weight. It's intracellular water weight. Don't worry about it. It's from strength training, but you also gain some strength from it because your body needs that rest. And when I would do that, I would do it twice a year. I would take off 2 weeks a year, separated, not all together. And when I came back, I was a little bit weaker in the beginning.
So you took 2 weeks a year
off, no
2 weeks
training.
and then 2 weeks, or 1 week and 1 week?
1 week and 1 week.
Okay.
Separated, okay? And when I came back, I was a little bit weaker in the beginning, but then I'd be stronger. And boy, the results I would get, it would just stimulate my body.
Really?
And it's because of all the stress. For the people who exercise a whole lot like us in here, and it can actually work against you. And that's when I did that show not too long ago about overtraining. And you overtrain, you'll start to get the symptoms, fat gain, weakness, loss of motivation, depression, and so on, of someone who doesn't exercise. So you'd be surprised.